start with the patient. What's going on with you? Let's get your narrative or subjective experience to your healthcare issue, your dysfunction, why you're even reaching out to the clinic in the first place, and then build up from there. So how can healthcare organizations create a more personalized healthcare experience for the patients that are coming to their clinic? The main way to do this is what I call taking a bottom-up approach to the process of delivering care. So if you think about the things that happen or that have to take place in order for a patient to receive care at your clinic, and then the way that those things take place, the steps, if you would, it's really built more often than not top down, meaning from an administration perspective down to the patient. So this is the information I need to get you booked into the appointment system. I need this kind of information to verify your benefits. I need XYZ. I need all of this. And then once I get all that done, we can focus on you and what your problems are and getting you into the clinic. A simple way to create a more personalized experience for the patient is just to flip that on its side, upside down, right? Start from the bottom up. Start with the patient. What's going on with you? Let's get your narrative or subjective experience to your healthcare issue, your dysfunction, why you're even reaching out to the clinic in the first place, and then build up from there. So we get your information, we get your narrative experience, we get your expectations, we get your goals for treatment. Why are you even considering us versus another clinic down the street or another organization down the street? And then once we get all that out of the way, the important stuff, then we do the mundane, the boring stuff. All right, let's get you booked on the schedule. Let's get your insurance verified. Let's get your date of birth. Let me make sure I got the right person. All of this kind of stuff done that obviously needs to be done in order for care to be delivered. But really the important part and the entire reason clinicians have a job in the first place is because of that patient and what's going on with them and their unique situation and circumstances. So we start with that and then we build up from there instead of saying this is what we need to get the appointment done or the services booked. And then after we do all of that, get all through the administrative stuff, then we focus on you, the patient. Really should be the other way around. And it's the same whether you're doing this in person, someone calls in the clinic, or you're doing this via some kind of tech portal like a patient intake paperwork packet or something like that, digital intake or something like that. We want to make sure that we're starting with the patient's subjective narrative experience and then building up from there.